Hi, everybody. Welcome to April 7th, Wednesday, April 7th. I'm Kim Bergen-Jackson, and I'm the administrator at Oak Knoll, and I'm back from vacation. I recommend a little bit of rest and relaxation for everybody. It's a spirit improver. The CDC came out with updated recommendations regarding domestic travel for everybody, and if you're vaccinated, which we all are, you are able to travel without fear of having to quarantine. I will say that some airports are better than others with social distancing. Social distancing is still required, and masking is required. There's no in-flight beverage or meal service anymore on the airlines, but there are a few airlines who are still leaving that middle seat open for social distancing. So I think that you can safely travel in the air if you are fully vaccinated. That is great news, I think. Here in Johnson County, our county positivity continues to go up slightly every time I look. This week we're at 5.4% positivity, which puts us in the moderate category for viral spread, which means that we're testing staff once a week, but we have always been testing staff once a week, and I just don't want to stop doing that. But I would caution you when you're out in the community. So the positivity just means that there's more cases of the virus active in the community. I would suspect at this point that it's the younger folks who are not yet vaccinated, and the governor has allotted the Johnson & Johnson vaccines for the major universities, and so the students will be getting vaccines, I think, before they go home for the summer. So things are looking up in that way. I don't have any changes to talk about with visitation. We had earlier thought that we would open visitation up a little bit to vaccinated individuals after Easter, but now we're going to put a hold on that while the county positivity and disease activity is a little higher. When we do open up to visitors who are vaccinated in the common spaces, we're going to ask you to monitor that. We don't have the capacity to monitor all the visitors who would come in to have meals or attend a program with you. And so I'm going to ask you to verify that your visitors have been vaccinated. But that's not happening now. We'll shoot for May for another conversation about that. We're going hesitantly and cautiously, as we have this whole entire time, to make sure we keep everybody safe. So I know if you have friends and family who are vaccinated, you're frustrated that they can't eat with you in the dining venues, but we are consciously putting all of those changes on hold while we wait a little bit longer for this virus to calm down and get more people vaccinated. I think the last time I checked the website, Johnson County was reporting 28% of people in Johnson County had been vaccinated, and that's good, but it's not good enough to provide herd immunity by any stretch of the imagination. So things are happening, and we're heading in the right direction regarding vaccines, but it's not happening as fast as we all want it to. So patience is a virtue. Be patient and confident that we will make changes as soon as we feel like it's safe for everybody. We did have a positive staff person this week when we tested. Monday we had confirmed that through the state hygienic lab that we had an asymptomatic positive staff person in the health center. And that caused us to go into outbreak testing. So we tested all the residents in the health center and all of the other staff, and we have no other positive test results, which is wonderful news. That means that the person who was positive wore their PPE correctly and their mask and their face shield the entire time that they were here, and it doesn't look like they exposed anyone else to the virus, which is great. We will continue to test people, the residents at least one more time, and the staff today we're testing them again, and then we'll test them next Wednesday. And hopefully when we don't have any further cases that are positive, we'll come out of outbreak status, and then we don't need to check the residents. I have had a number of people emailing me and messaging me to ask me, is this person who was positive a vaccinated staff person or an unvaccinated staff person? And I'm not going to reveal that information just because that's private protected health information, which sounds like baloney to some of you, I'm sure, but I will say this. The national average for healthcare workers receiving vaccine is only 40%, which is terrible. Oak Knoll is at 93%, and so there's only 7% of our staff, and we have 275 staff who are unvaccinated. And we're working on that. So we are continuing to offer vaccine. We have access to Pfizer, Moderna, and Johnson & Johnson. And so we will continue to provide education moving forward, trying and striving to get to 100%. The vaccine is not authorized by the FDA yet. It's still under the emergency use authorization, and there's a lot of discussion, especially in the state of Iowa, that it will not be legal to mandate the vaccine. So the governor is entertaining legislation that will make it illegal for us to mandate the vaccine. So, you know, if you're a politically active person and you want to get involved, you can let the governor know what you think of that. But there's a lot of people on both sides of the issue, personal choice versus public safety. I would prefer to have every person vaccinated here, but I cannot mandate it yet. So I hope that answers your questions. I know it's confusing and it sounds like there's a lot more to go into that than just the simple common sense decision to get vaccinated, but we can't mandate it. And even if we did mandate it, there are exceptions to the federal mandate for religious preference and medical condition. And so it's unlikely that we will really get to 100% just based on on those two exemption criteria. So trust me that I'm pushing for everyone to get vaccinated and providing education, and those people will remain in PPE while they're here to protect all of you and to protect us as well. If you have any questions about that, please reach out to me. I do check my emails all the time. It takes me a while to get back to people sometimes, but I will get back to you. Promises. Anything else I can think of? Things are going well. I think everybody's healthy. We're starting to open up and have some more events and small group activities, and that feels comfortable. I can't wait to have a big old party as soon as we feel like that's a safe and good idea. So I think that's all the updates I have for this week. If you have any questions, don't hesitate to reach out to me. I'm always available, and I will see you in 2 weeks. Thanks.